Morning, everyone. Sorry to get started a little late here, but thank you for joining me here today. First off, I want to wish all Manitobans a Happy New Year. 2020 was marked, obviously, by that C word, COVID, and the unprecedented public health challenges that it created and the economic challenges it's creating. Are new challenges, but they have shown Manitobans to be willing to rise to them, and that is exactly what we're doing. It's challenged us to new ways to be more resilient, to be more innovative, to be more determined, and Manitobans are demonstrating that they have the ability to do that as we bend this curve together. COVID-19's impacted all of us, some more than others, and my sincere condolences to all Manitobans who've lost a loved one to COVID. My thoughts, my prayers to all those who are battling this virus right now as well. Our number one priority continues to be protecting our most vulnerable Manitobans and ensuring our healthcare system's there for all Manitobans when they need it. Notre priorité numéro 1 dans cette pandémie est de protéger nos Manitobains les plus vulnérables et de veiller à ce que notre système de santé soit là pour tous les Manitobains. Quand ils ont besoin. I want to congratulate Manitobans for doing the right things, for celebrating Christmas and New Year's differently this year. We are monitoring very carefully. Dr. Roussin, our public health officials, are monitoring very closely the impacts of the holiday season. Those are yet to be known, but it is my sincere hope that we can continue to prove to Manitobans through the lower case numbers that we have been experiencing that Manitobans are making the difference in bending the COVID curve. And going forward, that is the goal that I hope we all share. It's a healthier future for all of us as we move forward, and we do our duty and do our part in these precious weeks to save lives. And that is exactly what your decisions on a daily basis can do. So, our immunization campaign is what I'm here to talk about today. It's underway, and since it was launched just 3 weeks ago, December 16th to be exact, as of the end of day yesterday, we've immunized over 5,165 Manitobans to be exact. Frontline healthcare workers, our vaccination team has determined, and I hope you agree, are our top priority. And so with careful planning and the arrival of more vaccine supply in Manitoba, we're now able to expand and to continue to do so until every Manitoban who wants a vaccine can get one. On Monday, we opened our first super site at the RBC Convention Centre as we ramp up immunizations to initially target more than 900 people a day, but we expect that number will grow quickly as more of the Pfizer vaccine becomes available, and the sooner the better. I just want to say thanks to the nurses who showed me around the site the other day. It was really instructive and encouraging to see the preparatory work that's gone on there, and the ability to ramp up as we go. It's already been built into the planning process, and that's really exciting. Thousands of appointments are booked for this week, and people will be coming back for a second dose in late January, and that scheduling is done as the first appointment scheduled. So that's really good organization on the part of our team, and there's many examples of that. As we receive more vaccine supply, we'll continue to use more of our planned capacity. We have the capacity to do a lot more than we're able to do because of the limited amount of vaccine we receive, but we're planning and we're hoping for the best, and so we're planning to be able to ramp up as soon as is possible. There's more detail, and there'll be more of a detailed explanation by more appropriate people from our vaccination task force later today. So I won't go into the minutiae of the planning, but just to suffice to say, hundreds, in fact, close to 1,000 civil servants are directly involved, not just civil servants either, Indigenous leadership, Métis representation, private sector participation. It's a broad team of Manitobans. This is a Made in Manitoba strategy for a once-in-a-lifetime challenge that we're facing together here, and I'm so appreciative of the hard work that's been going on for weeks now, months in fact, and the planning that's going on behind the scenes to make this rollout safe, successful, and efficient as well. The limiting factor we have in Manitoba, and all provinces, in fact, is the amount of vaccine. And so it's important to understand that we're ready to do more as soon as we're able to get more of the vaccine from Ottawa. So I want to share with you the next crucial phases of our vaccination rollout strategy and how we're going to make progress to protect more Manitobans from COVID-19. First of all, January's here. It's an important month for immunization. I referenced the first super site already at the Convention Centre, but the first super site outside of Winnipeg is going to be located in Brandon. It'll be at the Keystone Centre in Brandon, and it's scheduled to open on Monday, January the 18th. Secondly, with 7,300 doses of the Moderna vaccine now delivered to Manitoba, something we fought for, we will transport a majority of those doses to First Nations communities. Now, the Moderna is the one, you may recall, unlike Pfizer, which has got to be vaccinated very close to where it's stored, Moderna has the ability to be mobilized in outside areas. It can be transported and doesn't have to be stored at as low temperature, which makes it more appropriate to putting in place outside of Winnipeg, for example. Of the first Moderna shipment, 5,300 doses will go to First Nations. And we have plans already to ship them to areas selected by First Nations health leadership. We've set up a respectful process with our First Nations leaders as partners to deploy vaccines in northern and remote communities. You know, it's a different thing. Puckatawagan's not PEI. Thompson isn't Toronto. Rolling out a vaccine in Manitoba has more challenges, and our First Nations leaders have risen to the challenge of coming up with a game plan that we believe can work. And it's important also to understand that here in Manitoba, we're about reconciliation. So we're not going to do anything but partner with our First Nations leadership in the development of strategies that can work for them and for their community members. And that's the approach that's going to serve us well going forward. These processes take a little longer at the start, but they'll serve us well as we move through this. This is a marathon, it's not a sprint. Manitoba's Vaccination Implementation Task Force empowered our First Nations leadership in Manitoba and the federal government, who they partner with, to develop a plan for vaccine distribution more than a week ago, before the vaccine arrived. And that proposal was developed and received yesterday. And we will be acting on it immediately. And we're finalizing logistics. Our team is finalizing logistical challenges right now. We understand this is complicated, and I would not want these comments, and I'm sharing with you how this plan has come to be. But this should not be taken as a criticism of our First Nations partners, and nor would I want it to be taken as a criticism of Ottawa. It's complicated to get the community selected, to get the decisions made around allocations. It's not an easy thing to do. Manitoba values our reconciliation strategies, and we're going to continue to work with our First Nations partners through this process to make sure that we're following the right, respectful approach, the Manitoba approach, when we're making decisions about allocations. To address the need to get the vaccine to remote, isolated communities in northern Manitoba, I'm pleased to tell you today that a third super site's being developed at the Thompson Airport. I'm calling it Vaxport, and it's scheduled to open in early February. The airbase is going to serve people both in Thompson and in northern communities by air and by ground. Thirdly today, I'm really excited to share with you our plans to provide vaccines to the residents in our 135 personal care homes throughout Manitoba. Before the Christmas holidays, we started planning work with the operators of our care homes. As you can appreciate, there are some significant logistical challenges involved in this undertaking. Clearly, we want to make sure that for our seniors in the personal care homes that they are looked after because they're vulnerable. As we know, significant fatalities have occurred in personal care homes right across the world, and our folks that live in them deserve our protection and our love, and they have that. So we built a plan to immunize some of our most vulnerable people as quickly as possible. And now we know we can bring the vaccine out to them safely without them having to come, for example, into Winnipeg to a super site or to Brandon eventually. I'm pleased to tell you today that by mid-March, every single eligible PCH resident will have received both doses and the fullest protection we can provide them with against this deadly virus. Starting this coming Monday, January 11th, we will have our focused immunization teams, or what the vaccine group likes to call their FITs, stood up in each region of the province. These focused immunization teams will then start a really highly organized, and there'll be more questions I'm sure you'll have on this that you can ask the folks from the team later on. But they have a process designed to work through each and every personal care home in the province over a 28-day campaign cycle using both the Moderna and the Pfizer vaccines. They've developed a week-by-week plan to immunize an estimated 10,000 people living in our personal care homes across the province. This is an exciting bit of news. They're going to be able to tell you all of the prioritized care homes. They've developed a strategy on that. This afternoon they'll be releasing the full immunization schedule for all the PCHs. You'll be able to have a look. Manitobans, their family members that are, of course, vitally concerned about their loved ones in the personal care homes, will be able to have a look at the scheduling and get excited about that safety that's coming. The planning that these folks have done is incredible, and I just want to say thank you to them. Hundreds and hundreds of people have been mobilized to work on this vaccination team, and they are working really, really hard to make sure that this COVID vaccine is available to all Manitobans as soon as it can be made available. And I encourage you to get the vaccine when it is your turn to protect yourself, but also to protect your loved ones and to protect others and to protect your community as well. I've said before, I'll say again, this is a marathon. It's proving to be a marathon, not a sprint. 2020 has proven that, and the race is still on as we begin the new year against COVID. I continue to ask all Manitobans for their patience, for their understanding, for their compassion for one another at this crucial time as we roll out our immunization program, as more vaccines become available and arrive in Manitoba. We start this year, this new year, with hope. I can't stress enough, though, that we cannot let our guard down. We have to earn our hope now. We have to do our duty. As I said late last year, we have 90 days of duty ahead of us, and somebody asked me how I picked that, and I guess I just hope that we can spring into summer with, my sincere hope is with a lot fewer COVID cases and with a lot more optimism than we've been able to generate in the last number of weeks. When Manitobans were abiding by the fundamentals, we were beating COVID. And around Thanksgiving, the numbers started to shoot up, and we had that massive increase for the next few weeks. Now, those numbers are coming down. And I was pleased to learn yesterday that we're now 6th in terms of our number of cases per 100,000 people in the country. I'm saddened that other provinces have been unable to bend the curve the way that Manitobans have, because these are our Canadian friends and family in other parts of the country too. But I am impressed, and I'm emboldened by the progress we're making in Manitoba, and it's due to Manitobans. When we do well against COVID, it's because of you. And so I thank you for doing the right things. We're not there yet, though. And so, as the stern dad I sometimes am, I remind you that we cannot let our guard down now, that we must remember to be diligent, that we must remember to follow the fundamentals and follow doctor's orders. I'm not a doctor, but my mom used to say when my brother and I would get to quibbling in the house in the wintertime, she would say, "Get outside." And I'm pleased to see the number of Manitobans that are doing that. I've never seen our parks. I was by Beaudry the other day, for example, Beaudry Park out near Headingley. If you haven't visited, you should visit. You'll be having company, though, because I've never seen as many cars and as many people walking and with their dog or with their family having time outside. I've got news for you. We live in Manitoba, and we haven't had winter yet. We've been blessed with some wonderful weather, and we've been using it to get outside. Many of us have, and it's great to see. I see along the Assiniboine River people, I see the Riverwalk is plowed and nice now. I encourage you to get outside. I encourage you to do that. It's good for your mental health, good for your physical health and well-being. And as winter comes, and it will, layer up, get on a good toque, nice pair of mitts, get the dog. If you don't have a dog, get out anyway. and enjoy Manitoba's winter. It's a beautiful city here in Winnipeg in the wintertime. Manitoba's winters are glorious, and I encourage you to enjoy them. Thank you. Look forward to your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line this morning, you will have one preliminary and one follow-up question. Up first this morning from Global News, Malika.
Happy New Year, Premier. Wanting to know a little bit more about the vaccine rollout for Manitoba First Nations. I heard all of the stuff that you said about the team going through the logistical process right now, working on allocations. Just wondering if you could reiterate the number of Moderna vaccines. I think it was 53,000. And then we talked to the Assembly of Manitoba Chiefs about this, and they said that they're prepping right now. So just wanted to get some more information on that prep.
Sure. Well, the Modernas, as you know, our government lobbied pretty hard. I lobbied the Prime Minister on every call for a month to get more vaccines for our First Nations folks. The communities that have been besieged by COVID are too many, and it's not because the Indigenous leadership hasn't worked very, very hard to keep COVID out. It's just a very, very sneaky adversary. And we were given assurance by Ottawa that they would add to our allocation just under 10,000 additional doses, but that's not till the end of March. Right now, we've got our first allocation, which is 7,300 doses, of which a significant majority of that, over 5,000 of that, will be going to First Nations. And that plan has been in development for the last few days. The federal government, working with the Indigenous leadership, was asked to come up with a plan. That plan was received yesterday. It's being acted on now. The planes were ready to go, and now they're going to be going, so we're excited about that. It's a tough decision, right, allocating who gets and where the prioritizations are, and I understand the agreement is to start with elders and then go from there. But it's not, I think, unimportant to understand that our approach here in Manitoba is one where we want to partner with First Nations leadership respectfully, and where the goal here is reconciliation. And so some have said, well, you should have just sent the vaccines out right away. This wouldn't have been respectful, and it wouldn't have been the right approach. And I think First Nations leadership, certainly I've spoken to Arlen Dumas, the Grand Chief, and I think we agree that the approach we're taking is the more respectful approach, and that's the one that we need to use going forward. And this will serve us well as we move forward when we receive further vaccines of whatever type they may be.
Okay, and my follow-up question is about vaccine rollout for inmates in provincial facilities. We're hearing that federal facilities are getting the vaccine pretty soon here, so we're wanting to know what's the rollout for our provincial facilities.
I'll let the vaccine team tell you about prioritization. I think it's important to understand that this isn't a political decision. This is a medical-based decision. Our vaccine team has the difficult challenge of deciding who goes first, and they'll give you more detail on that in a few minutes' time.
From the Brandon Sun, Colin.
Morning, Mr. Premier. It sounds like the plan for vaccinating people at care homes is pretty well sorted out. So could you tell us what the role of this provincial director of immunization the province is looking to hire will take?
Again, I think I'll let the vaccination expertise that's going to be speaking to you and available to you in a few minutes' time address the technical issues around personnel and the structure. I can only tell you this, I guess, Colin, that there are close to 1,000 people involved in the vaccination task force team. The vaccination team is working night and day, and there are innumerable questions I'm sure that you and other Manitobans will have, and I hope that you ask them of the people who are doing the work.
I also wanted to ask about something mentioned in the release sent out by your government before this call. It said that everyone will receive at care homes their first dose of vaccine within 8 days of the campaign launch, as long as the vaccine schedule by the federal government stays track. How worried are you that those vaccine deliveries will sort of slip off that schedule?
I'll make 2 points, I guess. I'm less worried. Our vaccination team tells me that they have much more confidence now in the supply chain model, the deliverability, if that's a word, of the vaccine. And so on that front, not too concerned. But on another issue, there's been some comment come out of the federal government and from the Prime Minister and from the federal health minister critical of the provinces for not getting enough vaccines out fast enough. I would say this, I don't think that's helpful, and I would also say that here in Manitoba, and I can't speak for all the provinces, nor would I presume to, but here in Manitoba, we've done enough preparatory work that we're ready with a massive fire hose to fight COVID. We could get everybody in Manitoba who wanted a vaccine, that vaccine by the end of March. That's our readiness. We're ready for that. But unfortunately, that's not going to be possible because the federal government's process of getting vaccines to Canada means instead of a fire hose, we're working with a bit of a squirt gun right now. And so I would simply say this, we're ready and we're poised to get the vaccines out a lot faster than we're going to be able to get them based on the federal government's scheduling of vaccine availability.
From CJOB, Shane.
Good morning, Mr. Premier. Thanks for taking my call. We're hearing from healthcare workers who are having long waits on the phone to secure vaccination spots. We're wondering, is there any plan to have support staff added to help with these wait times?
Again, I think that's one of the challenges that we're working through, and I understand the vaccination team has made major improvements already, but I'm sure they'll have good answers for you as to any plans for further progress. It's not an easy thing. You have to monitor. In touring the other day and asking a number of questions, perhaps some of which you might have asked if you were there as well, I learned that they have a monitoring process that's got to be pretty scrupulous to make sure that the right people who are qualified to get the vaccine are the ones in the line, to make sure that their pre-qualification work is done, to make sure that people who are endangered are alerted to that by way of questioning. So the process isn't simple, but it's worth the wait. And so again, I'd suggest to Manitobans, I'd suggest to those who are concerned about waiting now, remember, you're in the 1% of the population that's going to get a vaccine. 99% of us would like to have those waits. We'd like to be able to get the vaccine, so put it in perspective.
Thanks for that. And I guess I should ask, we're about 2 days away from the current restrictions expiring. I'm wondering if you have any update on what we can expect once those expire.
I don't think there's going to be any significant change, to be frank. I think Dr. Roussin signaled very clearly that he feels it would be premature, and his advisory team feels it would be premature to move on lessening restrictions in advance of knowing what the case maturation might be as a consequence of the holiday season. And so I don't anticipate, and I think he sent that signal very clearly earlier in the week, didn't anticipate any major relaxing of the restrictions at this point in time. But I would note, too, that other provinces that have brought in restrictions much later than Manitoba, and there was a study from Oxford University that was published in the Globe and Mail last week that singled out Manitoba, actually, and said that we had some of the most stringent programs in the country, not just in the last few weeks, but through the entire COVID pandemic, that we led the country in terms of stringency on our programs to protect people against COVID. And since, obviously, Thanksgiving, we've stepped those up to great effect. Other provinces didn't do that, and that's not a criticism of them. They chose not to do that, and now you're seeing record highs in several provinces as the COVID situation is worsening in much of the country. This, of course, gives us all cause for concern. We've got friends and family in other parts of the country. This isn't a victory lap for Manitoba, but I say this to help encourage Manitobans who are making the sacrifices because of these restrictions that are saving lives, and to say thank you to them for making these sacrifices. This is, as hard as it is when you're in the middle of this battle with COVID, this is a short-term problem. We hope and we pray that we can come out of this with a lot fewer casualties as a consequence of the sacrifices we're all making. So I encourage Manitobans in being willing to make those sacrifices. You're saving lives. Thank you.
From the Winnipeg Sun, Scott.
Good afternoon, Premier. Scott Billick, Winnipeg Sun. First question. Prime Minister yesterday said that Canada will have access to a vaccine by September. I guess given the rate that we're putting it into arms here, is that realistic for Manitobans to think that they'll be vaccinated by September when we're only doing upwards of 900 vaccinations a day?
Well, look, our limiting factor isn't our capabilities here. Our limiting factor is how fast we can get the vaccine, Scott. So let's be perfectly clear about this. I mean, we're vaccinating. We'll have all the vaccines we can get into people's arms as fast as we can get them into people's arms. We're ready to take a lot more if we have to. We'd like to. But we haven't got enough water to fill the fire hose. We got enough water for a pop gun here, for a squirt gun right now. So, this is why I'm reacting a little bit, because I don't appreciate the Prime Minister attacking premiers for not getting a vaccine out when he's behind Denmark in terms of getting vaccines to Canada. And he's behind Israel. And he's behind the United Kingdom. And he's behind the United States. So, look, the Prime Minister wouldn't allow Manitoba and other provinces that wanted to buy vaccines to buy them. So he's going to be the guy who's making them available. And we'll only have enough for about 10% of our population in Manitoba by, say, the end of March, approximately. 10% of our population. But we have the capacity to get 100% of those who want it, the vaccinations, by the end of March, right now. So we're ready. If the Prime Minister can deliver more vaccines, we're ready to get them to people. And I want Manitobans to be really clear about that. Because we're hoping for the best here. We want to save lives too. We want that vaccine in the arms of everybody who wants to get it and is able to get it as soon as possible.
Thanks for that. How many doses are sitting in freezers right now in the province that haven't been put into people's arms yet?
Yeah, the bulk of the doses that are, as you described, sitting are probably today going to be on planes going to First Nations. So I wouldn't describe them as being anything but ready to go or in transit. There were a few days of delay, and again, I don't want that to be taken as a criticism of our federal government or the First Nations leadership they're working with, but they had to be given, I think, the chance to develop their prioritization and their strategies. If we had shipped out all these vaccines to communities our committee decided without consulting with First Nations leadership, I expect quite rightly we'd have been pilloried by some in the media, and rightly so. So we're working with our Indigenous leadership as partners, respectfully, and that's going to serve us well. Remember, this is a tiny, tiny fraction of the total vaccine challenge that we have to face together. And so the most important thing is to get the process right early so that when we move forward, we're working in tandem with one another and we're working respectfully with one another.
From CBC Radio Canada, Alexia.
Good morning, Mr. Premier. So Manitoba is the second worst province in terms of COVID death rate, and the vast majority of these deaths have occurred in personal care homes. So why are we starting to give the vaccine to PCH residents next week when Quebec, for example, has prioritized them from the start? What do you think about that?
You blacked out on me on the second part, Alexia. I'll just say this is why we're prioritizing delivery to seniors' homes, why we are pushing the vaccine out as a priority to our personal care homes, and why we have developed a detailed plan to do so. Because we recognize the vulnerability, it's clear. And we want to make sure that we do everything we can to help our seniors be safer, and we know that's exactly what Manitobans want us to do.
And so how many people will be part of those focused immunization teams?
I'm hoping that you asked me how many people would be vaccinated through the exercise. I think it's close to 10,000, and those are that's the approximate number of residents of all the personal care homes in the province that will be receiving the vaccine. Who wish to? We're not forcing them to, but who wish to receive it over the next a couple of months.
From CBC Manitoba, Bart.
Mr. Premier. You state that the limiting factor right now is the availability and the shipments of the vaccines, but when you look at Manitoba in terms of doses available and the vaccination rates, we actually lag behind every other province in the country. Even if you would take away the 7,300 Moderna doses, we still have, by my calculation, 8,000 approximately Pfizer doses sitting in storage. So to what do you attribute the Manitoba's slow rate of vaccinations per available dose so far?
Well, we just opened our super site at the Convention Center on Monday. I referred earlier to the respectful planning process we engaged in on the Moderna. And I can tell you that as of this morning, we were 5th in terms of percentage rollout of vaccines in the country.
Okay, well, we'll certainly check out those figures. At the beginning of the week, we were 10th. The other question, I know you were asked, you deferred on the role of the new immunization director, but why wait until now to hire an immunization director?
Well, that's a good question to ask the vaccine team. I'm sure they'll have a good answer. And I'm not disputing that we were slow initially to get the minimal amount of vaccines that we had out, slower than many other jurisdictions, because this is Manitoba. This is not PEI. Rolling out a vaccine in PEI is a different thing than rolling out a vaccine in Pukatawagan. And so, I think in defense of the 1,000 civil servants that are working on this diligently day and night, I would just have to say this isn't the same province as some of the provinces that went faster earlier. For example, reconciliation strategies don't matter as much in some parts of the country, perhaps, as they do to me and as they do to our Indigenous people in Manitoba. So delaying, a vaccine in the name of a process might seem like an unnecessary thing to do in another part of the country, but it is a necessary thing to do, I think, in the province of Manitoba, so that we get it right, so that when the 99.99% of vaccines come in here in future, we have a process that we know is respectful and that works towards building reconciliation and partnerships with all concerned, and in particular in our case with the highest Indigenous population of any province. I think it's very important that we get it right. And so we are 5th as of this morning, Bartley, but you can double check my numbers, and please do. And you're right in your assertion that we were behind other provinces as of a Globe and Mail article published yesterday based on the numbers from Sunday, I think.
From the Canadian Press, Steve.
Premier, you mentioned that we're unlikely to see any major changes to the public health orders when they're extended later this week. Are you going to offer another round of help for businesses, another round of grants, et cetera, if those have to remain shut down for several more weeks?
Absolutely. The finance minister will have more to say on that, Steve, I think tomorrow, and I will have more to say on it early next week. We've developed, I think, some of the most well-designed and most available and accessible program supports for small business in the country of Canada, and we plan on continuing to make those available as long as is necessary, because our small business community is critical to our economic recovery, and it's our economy in Manitoba that pays for all the stuff that we need, the social programs and so on. Our education, our healthcare system isn't free. It's funded by our functioning economy. So we need to make sure that we're doing everything we can to transition successfully into an active economic recovery as soon as we possibly can.
And as we're seeing the infection rates climb very high in Ontario and Quebec and western provinces as well, BC is climbing as well, Alberta, are you thinking of reimposing mandatory self-isolation from western areas as well?
I guess it's hard, Steve, because every time I praise Manitobans for doing well and bending the curve, somebody attacks me for taking a victory lap, and I'm not taking a victory lap here. I am proud of Manitobans for doing something that's not happening from Quebec to the West Coast in any other province. I'm proud of that, and I will say to Manitobans, I know it's hard. Some of these restrictions are very hard. very hard on families. I won't just say just the holiday season made it hard. It's hard on an ongoing basis to not be able to see family, in particular those of us who lost somebody, those of us that are dealing with illness, our seniors population, who I care for deeply, wants company, needs people around, real people, better than Skype. A hug's better than Skype. So we're going to do everything we can to make sure that we sustain the curve bending that we've done. And so that may mean looking at extending some of the restrictions that we have in place. And I hope that Manitobans, and I believe that Manitobans support that strategy because it is the one that will save lives, and ultimately it's the one that will allow us to start to get our lives back sustainably rather than jumping too soon to reduce restrictions, for example, which might cause us to then see a resurgence of COVID, which then means that we have to bounce down again with less activity and more restrictions later. This is not the yo-yo approach that I want to see us take. Other provinces delayed implementing restrictions like we brought in. We maintained some of the most stringent, according to Oxford University, in Canada throughout this entire pandemic. And we're going to have to continue with those restrictions for a while yet because we're not out of this battle yet.
From CTV Winnipeg, Jeff.
Hi, Mr. Premier. If I could just follow up on Steve's question there. You did say, talking about extending restrictions, but on travel specifically, would you look at bringing back that quarantine requirement from anywhere in Canada? Because to Steve's point, we are seeing case numbers rising, and, it's not just politicians traveling when they're not advised to, it's others as well.
Yeah, it's a very difficult thing, right? We've maintained the toughest, outside of Atlantic Canada, the toughest travel restrictions in the country, and we've maintained those throughout the pandemic. We lessened the restrictions for Western Canada early in the past year because case numbers were down in Manitoba, but they were also down in other provinces. Now we're seeing something of a resurgence. And this is a question for Dr. Roussin and for the medical leadership because, as you know, we have, although I totally accept the responsibility for ultimately what happens in terms of our restrictions, our health orders emanate from Dr. Roussin and his team, and I will look for their advice in terms of these issues on an ongoing basis. And if this is an issue that they want to see addressed, then I'm most certain that they will recommend it be addressed.
Could I just get a clarification on something you said earlier, or a couple things? Obviously, you said there's going to be these Moderna doses going north for First Nations and remote communities, and you said the super site in Thompson will open in early February. Does that mean people won't get doses administered until early February, or is there also another way that's happening? So I guess what I'm asking is early February the earliest people on Northern or remote First Nations are going to get vaccinated?
I think what I'll do there, Jeff, is my understanding is there's going to be vaccines made available before that site opens, and the vaccination team will be able to give you the detail on the rollout in their press conference in a few minutes' time. But then the super site will be able to accelerate that availability, obviously, because we'll have increased capacity and be able to bring some people into the super site as well. So that's an expansion of the strategy. But I haven't had a chance to, the Indigenous strategy was just forward late yesterday, and I haven't had a chance to read it myself, so I won't jump ahead of the vaccination team people. They've done the review. They'll be implementing it, so I'll let them answer. It's a good question, but I think it's best it's answered by the vaccination experts.
From City News, Stephanie.
Hi, Mr. Premier. Stephanie Olsuk from City News. You said we're ready to fight COVID-19 with, quote, a massive fire hose. We're hearing, though, some applications to work at the vaccination super site in Winnipeg haven't been replied to yet. Is the staffing for that vaccination center complete? And what's the status on the staffing for the other two centers that we're working on in Brandon and up north?
Yeah, it's a fair question, Stephanie, and I'm sorry. I think it's, again, I've got to defer to the organizational expertise of our vaccination team. They're dealing with not only staffing issues, they're dealing with the establishment of these super sites and all the logistical challenges around it. They're dealing with the storage capacity issues, and they'll be able to answer questions on that. They're dealing with the transport issues, and there's another very, very complex and interesting dynamic that's at work there with respect to not just Moderna, but potentially with some of the Pfizer vaccines as well. And they're dealing with personnel issues, recruitment processes to scale up, all of that. So I'll let them answer those questions. They're better equipped than I am to answer the detail with the detail that you might want.
Okay. And I know you said you haven't read the report fully yet, but will these FIT teams that are going into PCHs also fly to the First Nations or drive to the First Nations communities as well? Or how is the province directly supporting that work?
Yeah, again, well, I'm anticipating that ability to mobilize professionals and a team to get out into communities is going to apply to all our communities, Indigenous or not. As I mentioned before, and it's not an apology, it's a reality. It's a lot more challenging to deliver vaccines in northern Manitoba and rural Manitoba than it is in a place like PEI. And so, there's an element of challenge here that's being addressed, many elements of challenge that are being addressed, I think, very well through the thoughtful approach of our team. And I hope that you'll all have the chance to learn more and be impressed by the incredible work that so many of these folks have been doing so diligently for the last number of months, in fact.
From CHVN, Taylor.
Hi, good afternoon. Yesterday we got a press release saying there were 2,000 doses for personal care homes that were going to be going out next week. And today's release says 1,154 people in personal care homes are going to be vaccinated. So it's looking like about half of the doses that yesterday aren't being accounted for when it comes to PCHs. What's going on with these?
Again, you can ask the implementation team for the rollout details. They're going to actually be able to give you much more detail than I can or than I will take the time to do, but they can even tell you exactly which personal care homes are going to be getting the vaccines next week, and they'll be able to tell you the full immunization schedule for all the remaining PCHs there are. As you know, in the first week of the campaign, January 11, as is cited in my comments here, 7 locations representing every regional health authority will be immunized. Estimated 1,157 people in many of the homes in the city and around the province. And then continuing further, the full immunization schedule, which they'll release this afternoon, will hit every one of our seniors' personal care homes over the next number of weeks. And that's really exciting.
Thank you. And now we do have plans for care homes, but we also have a large amount of seniors who live outside of care homes with families, or they get home care to their own homes. What's being done for them when it comes to vaccines?
Well, you're talking to a senior, so I have an understanding of the interest people may have in getting a vaccine, and you're quite right. We have a seniors population outside of personal care homes that I'm sure will be a priority, but I won't decide on the priorities. The prioritization will be established by the medical experts of our province. Made in Manitoba strategy will be developed, and they'll be the ones who make those decisions. I expect age will have something to do with it, but again, that's for the experts to decide.
Our final reporter for this session from the Winnipeg Free Press, Carol.
Hi, Premier. Yesterday you said you weren't pleased with James Teichma traveling out of the province, but there was no way of disciplining him, such as removing him from cabinet. But Mr. Teichma was appointed to 2 cabinet committees as a backbencher in 2019, and he's the government appointee to 2 legislative standing committees. Could you not remove him from those committees if you wanted to discipline him?
Well, I understand that 3 NDP members, including their leader, travel out of the province as well, Carol. So to be fair, I think you could ask Mr. Canu what he's going to do to discipline his colleagues and himself.
So that's a no.
To be fair, that is a question, and you could ask the NDP what they're planning on doing. I said clearly yesterday I wasn't pleased with Mr. Teichma's decision. I know he regrets it, and I think that, quite frankly, it would be up to you to determine if you think this story needs to continue, what would be fair in terms of questions? If, in fact, it's true that 3 NDP members traveled outside the province, then 3 times as many of the opposition caucus, which is a third of our size, traveled outside the province. I would say it's a more significant problem for Mr. Canoe to address than it is for me to address. I've addressed it already, and I plan on continuing to do it. I'm proud of the fact that our cabinet members, none of them travel internationally. None of them has traveled at all. And that's not true of virtually every other government across the country, from the Maritimes to the BC border. So I think in fairness, it would be fair to observe that our cabinet members have been demonstrating their responsible behavior, and that we are effectively doing our very, very best to fight COVID. Your paper will have to decide what you're fighting.
A month ago that your clerk chairs the committee that oversees the vaccine implementation task force, and that it had been working on the vaccine rollout plan for months. Was that committee not doing its due diligence because Mr. McLaughlin was in Ontario for 2 weeks last month? Could that have hampered the slow vaccine rollout in Manitoba?
Again, Carol, you're putting some assertion on the record here that doesn't stand up to scrutiny. We are bending the curve on COVID. Our vaccination team's work, which you'll learn more about in a minute, is indisputably remarkable and puts us, in terms of preparation, in a position where we could actually inject everyone in Manitoba by the end of March with a vaccine, which we probably, because the federal government has been a little slower in getting vaccines out, may take months longer. That being said, the preparatory work led by Mr. McLaughlin and managed by our health leadership team and in partnership with our Indigenous leaders and private sector participants has been remarkable. I'm truly impressed with the work they've done. And so again, I think that the story is a positive one. But then again, some choose to focus on the negative as opposed to the positive. I would say in closing, thanks again to Manitobans. All the best in the new year. We'll earn our hope for a better year by respecting the rules that Dr. Roussin has put forward and by abiding by them. And I encourage everyone to continue to do so. Thanks, everyone.